So now we can move on to our next portion, which is the shelter survey results. This is where I'll have Landon kind of take over, but for everyone, I apologize for those that have already seen it a couple of times. I know there's a few of you on here that haven't, so we look forward to sharing this information, getting some feedback. But just a little bit about the shelter survey. This was actually something that was suggested and really advocated upon by our lived experience working group. They were the ones that were really facilitating the conversation around, you know, the shelter system and, you know, why is it that some folks don't want to go there and how we can understand why and, you know, ultimately try to change some of, you know, whatever's deterring individuals from wanting to access these services. So we were able to work with local shelter providers, PATH, Rescue Mission, Good Samaritan, or sorry, Salvation Army. We actually did work with Good Samaritan with Dignity Moves and Transition House and domestic violence shelters here in town. So they all participated and were able to dedicate some time to complete the surveys. And so Landon now will share his screen and then we'll jump into those results.
All right. Is everyone able to see the PowerPoint slides there? Because of the way I'm screen sharing, I may not be able to see your questions as easily, so I'll rely on Catherine to call out if there are any. But do feel free to chime in with any questions or comments as we go. So I would be remiss if I didn't mention this shelter survey happened in big part because of a push from our individuals with lived experience that we work with. Raj Powell and others were really wanted to see this happen and help us to get this off the ground, really helped us form the survey itself. And so this is really something that we see as coming from people who have the lived experience. And so we really wanted to find out the positives and the negatives as much as we could to understand what are we doing well and where do we need to grow. So in total, we surveyed 184 individuals, a little less than 25% of our population experiencing homelessness in the city of Santa Barbara. The demographics, I just wanted to show briefly, they're fairly representative based on our point in time count data from 2022. So I say this just to say that in terms of age, gender identity, ethnicity, and race, we're not more heavily skewed than our population in general. And so we feel fairly confident that these the findings that we have are fairly representative of our population locally. So we did ask of those who took the survey where they stayed the night before. You can see about 64% said that they stayed at a congregate shelter the night before. We had a number that had stayed out on the streets or in temporary housing. And we also asked where they had stayed in the last year. And about 75% told us that in the last year they had stayed in one of our congregate shelters. Also, just terminology-wise, when we talk about congregate shelters, we're talking about where everyone is staying together, as opposed to a non-congregate setting like Dignity Moves, where everyone has their own unit. So, so this survey was really focused on those congregate shelters. So even though we had about 74% said they had stayed at a congregate shelter in the last year, you'll see on a later slide, we had a lot of individuals who have stayed at one of our shelters at some point in their lifetime. We had individuals who said they had stayed at Casa Esperanza, for example. So some of these individuals, even if they aren't currently or have not recently stayed at a shelter, they have been around the shelter system. The majority of our folks said that they were experiencing homelessness by themselves. We did get a small sampling who were staying with a family or domestic partner, including several, close to 30 who were staying at or who had experience staying at Transition House with a family or partner. And about 90% of those who took the survey said they had used shelter services at some point in the city of Santa Barbara. So it could be any point in their lifetime. And we did make it really clear that when we were talking about shelter services, we weren't only referring to staying overnight. We know that some of our shelters offer just a meal if someone wants it. So we included that even if they've just gone to a shelter and gotten a meal or a shower, that would count as having utilized shelter services. But we also did want to get surveys from people who have not stayed in our shelters, or people who maybe they had in the past but are actively avoiding them now, because we really want to hear, why is that? Why are you avoiding the shelters locally? So of those that we surveyed, a little more than 60% have stayed at the rescue mission at some point. A little more than 50% had stayed at PATH at some point. About 27% at Salvation Army. About 18% at Transition House, and so on. If you're not familiar, Noah's Anchorage is our local youth shelter as well. And then under other, that's where we had some people mention they stayed at Casa Esperanza. Others said Dignity Moves, or other maybe non-traditional shelters or non-congregate shelter settings. I also just want to throw out big kudos to all of our shelter providers for helping us to admit the survey. We really appreciate it. This is why we were able to get the sample size that we got. And so we asked how recently they've utilized shelter services, whether or not they had stayed at a shelter, and about 60% said that in the last night they had, whereas close to about 85% had stayed at a shelter within the last 6 months, or had utilized shelter services, I should say. We also asked what kind of services they'd used. Meals was the most common, more than 90%, followed by showers at about 87%, and then overnight stays at 76%. We only had 7 individuals who responded saying they had never, ever utilized shelter services in the city of Santa Barbara. As I mentioned, we did have a lot more individuals who said, maybe I'm not staying at a shelter now, but I have in the past. And so we did ask why, but I'm not going to get into this now because there was only a small sample size of the folks who had never stayed at any of the Santa Barbara city shelters. So now we'll get into the actual feedback about our shelters. And I want to be really clear, we did not ask any shelter specific questions. So at no point did we ask, tell us what you liked and didn't like about PATH. We just asked in general, what have been the positives and the negatives about your experience in the shelters locally. We were able to filter some of the findings so we could see how people who have stayed at PATH responded, but that didn't necessarily mean they were only talking about PATH, because they had also stayed at Rescue Mission, for example. But for today, we're just going to go over the general findings because it's a little easier to summarize. So first of all, we wanted to talk about the positives. We asked what were the top 5 things that made you feel the most comfortable in a shelter setting. And we actually offered a list of about 20 things, everything from having a clean sleeping area to having good food to feeling like the individuals felt fairly treated based on their gender expression or identity, to saying they had effective locked storage, etc. So of those 20 things, these were the top 5 most commonly chosen. I have the full list that I can share as well, but it's a little hard to read if you have all 20 on the screen. So the number 1 was staff and volunteers. We do want to give a big shout out to all of our staff. We had a couple people that wrote in the comments that they've realized how hard it must be to be on staff at a shelter, and so they were grateful for the staff. So more than half of the individuals said staff and volunteers. They also said that they found it to be a welcoming environment in our local shelters, followed by having a clean sleeping area, sense of safety, and having good food. We can share out, we're recording this meeting right now, but we can share out these slides afterwards as well. So then we asked about the negatives, and we asked what made individuals feel less comfortable in a shelter setting. And again, similar to before, we gave them about 20 options. These were the top 5 most frequently chosen. What's interesting to note, you can see that the bars are much shorter on this slide, and that's because out of the 20 options, the responses were a lot more diffuse. Whereas there was a lot more agreement about the things that made people feel comfortable, it was a lot more spread out in terms of the things that made people feel uncomfortable. But that having been said, close to 30% indicated that the idea of a communal sleeping area, not having privacy between the beds, was the thing that made them feel the most uncomfortable. Use of drugs and alcohol in or around the shelter setting, having a strict curfew, feeling unsafe, and then or other. And then under other, a lot of individuals mentioned that even though shelters might have locked storage, they still found that there was theft. A few others mentioned feeling judged by other individuals staying at the shelter, or that they found it difficult to maintain their own sobriety when they were around other individuals who maybe were not as serious about that. And I do just want to say as well that the county of Santa Barbara had done a survey asking individuals why they avoided shelters in the last year, and that communal sleeping area was actually one of their #1 findings as well. So we see that consistently throughout Santa Barbara County. We asked about their sense of safety. We had about 20% indicated that they felt some degree of unsafe at the shelters, whether it was moderately or very unsafe. And about 60% indicated they felt some degree of safety at the shelters. About 20% there felt neutral. So when we asked them what kind of things would make people feel more open to accepting a referral to a shelter environment, because we all know that there's many individuals who say, I don't want to go to that shelter or this shelter for a variety of reasons. And so when asked, individuals said having private showers was the most commonly chosen thing to make them more open, followed by having those separation between the sleeping quarters, as I mentioned, that non-congregate style. Feeling supported in their personal goals and priorities, having a locked storage area or secure storage lockers, or other. And again, this is where people mention things like the safety around theft. Some individuals also mentioned having a little bit more enforcement of rules and regulations, having rules and regulations handed out to all guests as they arrive. And then we asked, what types of additional services would you like to see in a shelter environment? The #1 was transportation services to or from the shelter sites. We had a number of individuals who stated that they felt like the shelters were out of the way or difficult to access. Having more access to housing services in the shelter setting. A couple folks said there are housing services on site, and yet sometimes they didn't feel like they were able to progress to the next level. They felt like the housing services offered were only able to take them so far. The ability to stay at or around the shelter for longer hours, for example, being able to stay at the property all day, or recreational areas. We did get quite a bit of qualitative data as well. This is just a sampling of some of the quotes that I'll leave on the screen for a minute for you to take a look at. But you can see it was a smattering of positive and negative. We had some individuals who really expressed a lot of gratitude for our shelter providers, and then some really specific comments about things that they wanted to see improved. And I'll just leave this up for a second for you to read before we'll go to discussion. All right, so I just want to open it up. I'd love to hear any reactions, especially from those of you who are new to seeing this data, or hear any questions.
And maybe I can start us off too. Just some of the feedback when we initially shared this amongst the shelter providers was a feeling of kind of relief, where some of this information wasn't necessarily new to them. They kind of knew just in working with their clients at the shelter that they had these feelings around, curfew, for example. But now having it in this form, kind of on paper, really something that we can use and, look back at, they were excited about, but a lot of the information, the results that they were seeing wasn't necessarily new to a lot of the providers. And I don't know, I think Kevin, I think you're still on the call if you maybe wanted to speak a little bit to that as well.
Yeah, I think it was great. It's always good to hear what the folks you're serving think about what you're doing, because sometimes there's a disconnect between what we're doing and what they're receiving. And I think this is a great way for us to pay attention to those things that are on this questionnaire to work on. You know, when you're dealing with folks who are broken and hurt, you're always going to have issues. But I think that trying to respond compassionately and lovingly to their issues is something that we want to try to continue to do. And definitely as a staff and as a team, we're looking at how we can make things better for them. You know, I mean, we probably will not run out and buy a bunch of Andy's chocolate mints and put them on their pillows. But who knows? I mean, we want to, you know, serve them, and part of that is, you know, that structured compassion and how we want to just treat them, and yeah. So I think thank you so much, SB Act, for this. We are already starting to look at some of our policies and procedures to see how we can make things a little bit more or less institutional within the congregate shelter system, and because I think that would be a huge help. And so thank you for what you're doing.
I see a question about whether a prior similar survey had been conducted. Not that I'm aware of. I don't know. I think in talking to our shelter providers, they had said that they'd wanted to do something like this for a while, but I'm not sure if there's others. I think I see a hand raised from Jonathan.
Hi, sorry about that. My meeting ended early, so I was able to hop back on. I wanted to echo what Kevin shared, that I'm very appreciative of this survey because it really uplifts the voices of the people that we serve. And I think it really also provides insight that people who are unsheltered really want the help, and they're clearly outlining to us what would be more helpful to them in terms of the supportive services made available to the in the shelter, and in terms of their safety and space. And so I think, you know, I just want to share, I hope that as we look for both congregate and non-congregate solutions and services as we move forward, that I hope this survey continues to inform the service models that we create. Yeah, that doesn't sound good.
Thank you, Jonathan. And with that, I think it is really important for us to share kind of what are we going to do with this data now that we have it. And so from our end, we have a couple more audiences we want to share this with. We are going to be sharing this back with the Lived Experience Working Group. We really want to get this back into the hands of the people who took the survey as best we can. And so we'll be working with them on that. We also want to share this with local funders as well, just so that they're aware of, like, these are some of the specific things that it would be great to grow if we can find the resources for them. And then we also want to continue sharing with all of our local agencies. We'll be sharing at the Elected Leaders Forum in the coming weeks with the county. In terms of action steps, then we will be working with the shelter providers to figure out what is each individual shelter's kind of action plan out of this, using the feedback that they gathered. And then to Rich Block's question, I think there is that long-term step of how do we keep this going as a regular recurring thing so that we can see what the trends are over time. And so we'll have more to report back in the coming months about where we're going with that. Any other questions or feedback? All right, I'll turn it back over to Catherine.